I want to share my experience and knowledge of working in infectious disease respiratory wards in Hong Kong. Now, I'm going back to the 80s in the tuberculosis ward, and we don't think of that disease nowadays. However, there are a lot of interesting correlations with this and the coronavirus, and I'm going to be making the point about what we can do other than worrying about the non-existence of a vaccine or a treatment. So in the 18th to 20th centuries, almost 1/3 of Europe died at one point of tuberculosis. Like the virus, it was infectious, it was transmitted by a respiratory droplet. There was no drug to treat it, and people really didn't know anything, of course, about bacteriums or viruses in those days. Also, like COVID-19, it was affecting certain sectors of the population more than others. It was known as a disease of overcrowding and poverty. And even in those days in New York City, the death rate of whites to black would be 1 to 3. So we're finding this again, of course, with any infectious disease. It's easy to infect people if they're all living close together. And also with poverty, they're malnourished people whose immune systems don't work as well. So what happened with tuberculosis, however, is with increased knowledge of public health measures, the rate was decreased by 90%. So this was actually before the vaccine was widespread. That was invented by the French in 1921. It was before antibiotics were invented to treat it. Public health measures, sanitation, hygiene, and putting people out in the fresh air and the sun was the treatment. Now, I feel this is a very positive thing because pandemics are pandemics of infectious disease, and the correlation also perhaps with HIV. Almost 40 million people in the world have HIV. As you know, people used to die of AIDS. However, the major factor in AIDS was not so much the antibiotics reducing the incidence, but sexual health measures, right? So I think this is empowering when we're so far away from vaccines to realise that public health measures work. And perhaps we've been lucky in Hong Kong because we're 6 million people, 7 million in a very small place. However, our infectious disease numbers are now down to single digits every day due to hand washing, due to relative social distancing and taking care, and also wearing masks. So I thought this was positive information to share with you, and I'll be back every week to share some more.